Hi, my name's Jessica. I'm going to be your nurse for today. Are you able to verify your name and date of birth? Okay, very good. The doctor wants to do some suctioning to get the secretions out to help you breathe a little bit better, so that's what we're going to be doing. I'm just going to put some oxygen on you to hyperoxygenate. I'm going to go grab my supplies, wash my hands, and I'll be right back. So I'm going to provide for privacy, wash my hands, make sure I have all of my supplies. Let me go back in the room. I'm going to assess the need for suctioning, make sure they actually need to be suctioned. I'm going to check my suction, make sure it turns on and off, everything's working. I'm going to set it to 120. Okay, after that, I'm going to check my saline, make sure it's clear, the expiration date, if it's opened or not opened. If it has been opened and I'm reusing it, I'm going to lip it and then pour it into my basin. But for this instance, it has not been opened. I'm going to grab the bottom of my basin at the cardboard, making sure I'm not touching the top. I'm going to pour some of my saline in. I'm going to open my lubrication and put it on inside of the 1-inch border. I'm going to don sterile gloves. I'm going to wrap my tube around my fingers. Now this is going to be my dirty hand. Once I touch the suction and all of that, this is going to be my clean hand. This is what I'm going to be suctioning with. So I'm going to attach the two. I'm going to suction some of that saline and make sure that my tube is clear. I'm going to lubricate the tip of my tube, keeping control at all times. You want to make sure that you're not cross-contaminating, that this stays sterile. I'm going to take the oxygen off of my patient. I'm going to insert 16 centimeters, making sure that my glove's it's not touching my patient's nose, because my hand needs to stay sterile. If you meet resistance, you want to come back 1 to 2 centimeters and then insert it. Go ahead and insert it again. Now I'm in 16 centimeters. I'm going to roto-rooter and suction at the same time, keeping control. Okay, after that, I'm going to put my oxygen back on my patient. I'm going to clear my tube of secretions. And then I'm going to assess to see if they need me to do the suction again. If I do need to suction again, I'm only going to do it twice. If after the second suction they still need to, if they still have secretions, I'm going to notify the physician and let him know he needs to take other interventions. In between suctions, I'm going to wait 1 minute. If I was doing a nasotracheal suction, I would insert 14 to 20 centimeters. I'm going to document the date, time, patient tolerance. And the O2 saturation, you want to document what their O2 is after you suctioned and how many times you suctioned. So if you did it once or twice, and then what other interventions, and then that's it.